Well, thanks, everybody, and thanks for the invitation. If I was going to describe my talk, I would say I'm going to get into the weeds a little bit on Marilyn's talk before to go into some of the little bit more details on the origins of dementia and the current state of research. Let's see. Oops. Sorry, I got to go back. So if you look at a chart on what causes dementia, this is what I call the pie chart view of dementia, that there are several different causes, all of which can be neatly put into different groups, with Alzheimer's being the biggest, and then vascular dementia and other dementias having their role. But what we're going to talk about today is that in older folks, which is the largest demographic group getting dementia diseases, it's much more complicated than that. Now, if you look at the brain of a patient with dementia, and remember what Marilyn said, dementia is the description of what someone has. They have memory loss and cognitive problems. They can't drive anymore. They can't do the checkbook. That's what we call dementia. You'll see in their heads the accumulation of this abnormal protein. This is stained with something called silver, and a normal brain would be completely clean. And this brain is just chock full of this crud, this amorphous material that we call amyloid. And if you look, this is from our own study, the Baltimore Longitudinal Study of Aging. If you look at how much of this stuff you have in your brain, at the time of death, there's a pretty good relationship between how much of it you have and your likelihood of being demented at death. So the more of this you have, the more likely you are to be demented. And this was originally described by Dr. Alzheimer 100 years ago. This stuff, this amyloid, turns out to be a very small peptide, which is a very tiny bit of a much larger protein. So in our brains, there's this protein called the amyloid precursor protein. And as part of your brain's normal working, the brain has to get rid of this protein just to renew itself. And as part of getting rid of this protein, it just, with a pair of scissors, starts chopping off little bits of it. And as part of processing, this little peptide is released into the extracellular space in the brain. And there are several different enzymes that cause this chopping. And these enzymes that chop up this APP protein are the subject of what most pharmaceutical companies are trying to develop for treatments of Alzheimer's disease, to kind of block these enzymes and prevent this little peptide from being generated. So what everyone in the field says, and Marilyn alluded to it, well, you can't be treating people way over here when their disease is advanced. You've got to be treating people way back here early on when they have abnormal PET scans or their CSF beta 42 is low, but they're still completely normal cognitively. That's the kind of patient that we have to treat in these trials, not patients with dementia that's already well established. But it does make you worry. And the New York Times did a series of articles after the Lilly trial came out saying, researchers in doubt, is the amyloid hypothesis real? And it makes us all sit there and scratch our heads. Is the amyloid hypothesis real? The question is this. Amyloid definitely builds up in the brains of patients with Alzheimer's disease. But the argument is it building up just because the brain is dying? And the brain is dying, the amyloid is just what we call a tombstone phenomenon. It's just there because the neurons are sick. And it has nothing to do with the disease. And that treating it isn't going to make the patients any better, because it's not the cause of the disease, it's just a sign of sick neurons. Okay? But amyloid is a specific pathology. Sorry about that. Amyloid is a specific pathology. There are many brain diseases, frontotemporal dementia, Parkinson's disease, stroke, football players who get hit in the head too many times. They all develop brain diseases, yet don't have this A-beta accumulation. So this A-beta accumulation appears specific for Alzheimer's disease. The second thing is what Marilyn talked about earlier, the genetics. That when you're in doubt, we always go back to those autosomal dominant Alzheimer's cases. There aren't many of them, but they're incredibly important because these are mutations in that amyloid precursor protein itself or in the enzymes that process it, the gamma secretase, base 1, et cetera. So all genetic causes of dementia or Alzheimer's disease can be traced right back to that A-beta peptide. So although these trials have been failures, I think most people who study this disease carefully say it still is all about amyloid, and we have to develop better drugs and try them earlier to prevent this accumulation of this abnormal protein.